Good morning and welcome to Under the Magnifying Glass. This is one of a series of podcasts where we are looking under the magnifying glass with regard to health claims made for dietary supplements marketed for immune health. My name is Dr. Patricia Doister, and I'm a professor in the Department of Military and Emergency Medicine at the Uniformed Services University of the Health Sciences, or USU. I'm also the executive director of the Consortium for Health and Military Performance, or CHAMP. CHAMP is a defense center of excellence located at USU in Bethesda, Maryland. CHAMP promotes and endorses the Department of Defense Total Force Fitness Framework of holistic, proactive support of service members, their families, and communities. We have two primary educational platforms at CHAMP. The first is Human Performance Resources by CHAMP, or hprconline.org, where resources are provided to help you on your quest for total fitness and human performance optimization in the areas of psychological, social, family, behavioral, nutritional, spiritual, and physical fitness. The second educational platform is Operation Supplement Safety, or OPSS.org, and this focuses solely on dietary supplements. At OPS, we provide tools, educational materials, and other resources to help supplement users make informed decisions about dietary supplements they may be looking at in hopes of optimizing their health, performance, and their careers. If you're just tuning in for the first time, we're talking about immune supplements or immune boosters. Make sure to check out our earlier Under the Magnifying Glass immune supplement podcast, where I was joined by my colleagues from USU, the Henry M. Jackson Foundation, and the NIH's Office of Dietary Supplements. Together, we shared the evidence surrounding immune products and ingredients, the claims made, and some tips for choosing products wisely based on the research that we've recently conducted. Today, I am speaking with our expert panelist, Lieutenant Colonel David Whaley, who shares with us about dietary supplement use specifically in the military. We know that many of our service members use dietary supplements in an effort to stay strong and maintain health and wellness. And of course, immune health is critical to military readiness. Today, we are going to discuss whether immune supplements might be helpful to our military community. We will also dig into some of the evidence specific to the vitamins and minerals we researched. Lieutenant Colonel Whaley, or Dave, welcome. Thank you for contributing to our research project and for speaking with us today. Please introduce yourself.
Sure, Patty. Thank you, and good morning. I'm Dave Whaley, and I currently serve as the Reserve Component Pharmacy Consultant to the 3rd Medical Command Deployment Support, which is a 2-star general command where we deploy Army assets to much of the world, including the Middle East and Central Command. On the civilian side, I'm a medical director with Pfizer in the area of rheumatology and immunology. And as you know, you and I recently published a manuscript in the American Journal of Medicine entitled A Threat to Military Combat Power, Dietary Supplements, where we described 6 cases of soldiers who had to be hospitalized or evacuated home after taking dietary supplements. So it's great to be able to have this discussion today.
Great, and thank you again for your contributions to our project and what you bring to these discussions about the evidence for select ingredients for immune health. Before we get started, I have to mention our disclaimers. So what we'll talk about today and throughout our series are our own opinions and do not reflect the official position or policies of the Uniformed Services University, the U.S. Department of Defense, the National Institutes of Health, or the Henry Jackson Foundation. Any mention of trade names, commercial products, or organizations does not imply endorsement by the U.S. government. Some of the common claims made on these immune supplements are actually about resilience to help your immune system face challenges to your health, such as support the body's response to stress and fuel the immune system, primes the immune system to protect the body against daily stressors and environmental challenges, immune defense, and daily immune boost. We know our service members are exposed to environmental stressors, austere environmental conditions, and challenging physical and other types of daily stressors. Lieutenant Colonel Whaley, do you think these kinds of claims resonate with service members? What are you hearing or seeing on the ground?
Thanks, Patty. Yes, so in addition to the fitness requirements of the military, many, if not most service members, and in particular soldiers and Marines in the deployed setting, set goals for the deployment to fight the boredom of being alone and deprived of normal life activities. As you know, there's no sex, alcohol, freedom of speech, freedom of movement, and so on in combat zones. And so they typically set goals to either lose weight or gain muscle or a combination of the two. And obviously remaining free from colds and the flu and COVID and other illnesses is the goal. As we noted in our paper, this is where the claims of these supplements are most impactful. Some of the combinations of stimulants make weight loss claims, and some are marketed as mass or bodybuilding for building muscle supplements. And the most concerning are the combination of the two, which are marketed as fat shredding. In our paper, we described, again, those 6 cases of soldiers who had to be admitted to the hospital or sent home after using supplements. But that was a small portion. We probably saw 20 cases at least forward in Afghanistan. So although the immune supplements are popular, we haven't noticed the same level of toxicity as we have with the weight loss and the bodybuilding supplements, at least so far. However, it's hard to say since multiple supplements are often combined. I think I told you the story of one of the soldiers who became aggressive and had gained 70 pounds of muscle in a 10-week period. We landed in a July 4th weekend, and we had to send him home on September the 21st or 22nd. When he, became aggressive and obviously carrying around loaded weapons. We can't have that. And when the military police raided his room, he had 81 bottles of supplements in his room. So these immune supplement claims do resonate with service members because they do work closely with the troops from other countries and the local population. And many expect to encounter different infectious diseases and illnesses as they adjust to these new environments. The resilience claims do resonate well with service members for another reason, because they are often expected to work long shifts with little or no downtime and be at peak performance during all of this time. And certainly some service members don't believe that they get all their needed nutrients from their military diet. And as you mentioned, this is especially true in the austere environment where they don't have the option to pick and choose their foods as much, especially if they're eating MREs or meals ready to eat rations.
Thanks, Dave. We are really grateful to you for joining us today because first, you can actually speak to what is happening on the ground. And second, what we learn from you can help us address the needs of the military in our research. Only then can we deliver meaningful, evidence-based resources to all military communities. Again, thank you. As mentioned before, we have evidence-based information on ops.org to help service members make better decisions about using dietary supplements. In addition, we have an Ask the Expert portal through ops.org, where service members or providers can submit questions about all things related to dietary supplements and receive evidence-based responses from our ops team. A question came in just recently about immune supplements from one of our service members. The question stated, are immune supplements approved or allowed for military personnel? I've seen products listed as added immune health bonus. I don't want to try or buy anything without knowing for absolute sure. For those of you who don't know, the Department of Defense instruction was signed in March of 2022, Instruction 6130.06, if you're interested, regarding the use of dietary supplements by service members. This instruction established an official list of prohibited substances and identified OPS as the go-to website resource for the Department of Defense. It is actually the only program in DoD for dietary supplement information. Service members can go to ops.org and type in an ingredient from the product label to determine whether it is prohibited. And soon we're going to have an app where a product label can be scanned to see what ingredients might be prohibited or risky. For immune supplements, as Lieutenant Colonel Whaley noted, we would not necessarily expect them to cause harm or be prohibited. But as we know, manufacturers are both creative and they want to make money, and they know service members will purchase products. So we want to be safe, especially for ingredients you are unfamiliar with in particular. It's always good practice for service members to check the prohibited list on ops.org before purchasing any product they might be considering. As for our research evidence to support claims such as immune health bonus, the ingredients listed on immune health products do not overall appear to have strong scientific evidence for or against their use, at least not for otherwise healthy consumers who are looking to enhance immunity, resist getting sick, or recover more quickly in the face of a stressor or an illness. However, if you are unable to fill your plate with the wholesome, nutritious foods that you need that will provide the necessary amounts of vitamins and minerals to stay healthy, some dietary supplements may be useful. In fact, some research suggests that certain vitamins and minerals, such as vitamin C, D, and zinc, may be especially helpful when exposed to certain stressful or environmental conditions. So what does this mean for the military community? Let's dig into some of these vitamins and minerals, and let's start with vitamin C. Lieutenant Colonel Whaley, what would you tell a service member about vitamin C supplements?
Thanks, Patty. What I would indicate is that most people can easily get the recommended amounts of vitamin C through fruits and vegetables they eat in their diet, equivalent to the size of a medium orange a day. The latest research shows that taking a vitamin C dietary supplement may not reduce the risk of developing a cold in general. However, it may be helpful as a supplement when exposed to certain stressful environmental conditions, such as what the military experiences. Studies involving individuals, perhaps more so in males during times of extreme physical exercise, report less symptom severity or days sick from upper respiratory infections, such as the common cold, when taking vitamin C up to a gram a day throughout the winter months. Overall, vitamin C supplements don't seem to be a huge concern. I would say that we haven't seen toxicity or adverse events on the ground with vitamin C, as it's a water-soluble vitamin. But we always encourage individuals to eat healthy foods first.
Dave, vitamin D is another ingredient commonly touted for immune health. In fact, during the COVID pandemic, one of the top immune boosting strategies being marketed. We know that vitamin D insufficiency is common in the US, and it may be important to get your levels checked by a physician from time to time. Levels below 30 nanomoles per liter, that's serum 25 hydroxy vitamin D, might affect overall health in some individuals. Levels between 50 and 100 are generally considered adequate. Too much vitamin D, however, can be harmful and lead to potential toxicity. You may experience nausea, vomiting, or even kidney stones. Excessive amounts could even lead to more serious health issues, including kidney failure, and in rare cases, even death. Nearly all vitamin D toxicities are due to taking excessive amounts of vitamin D supplements over time. And what qualifies as a high amount can differ depending on the individual, as it is almost impossible to get too much vitamin D from sunlight or food. So, Dave, what do you think about vitamin D supplements for immune health?
Sure, Patty. So, as we know, vitamin D is an essential vitamin, important in maintaining bone and overall health, and it helps our body build immunity. It's found in foods such as fish, eggs, and fortified milk. And also when your skin is exposed to sunlight, it manufactures vitamin D. So the photons from the sun change cholesterol into vitamin D. However, it's challenging to get vitamin D this way in the winter months, especially if you're wearing clothes such as military uniforms that completely cover you up, or if you don't work outdoors, you do shift work, or if you have dark skin. And it's even more challenging to certain military populations. For example, the military goes to a variety of locations, Africa, Alaska, Greenland, the mountains of Afghanistan, where I recently was. These areas get little sunlight. In addition, the military performs unique jobs. I'm thinking of submarines or the Space Force sitting in dark rooms for 12 hours a day with little or no sunlight. And there's a unique military interest in this topic, and understanding the role of vitamin D would be important in certain military contexts. The amount you should get does depend on your age, but for adults, the recommendation is 600 international units or 15 micrograms per day, which is equal to about 5 cups of fortified vitamin D milk. And I would say the data to support supplementation with vitamin D in young, healthy service members who get adequate sunlight is very little at best. However, if that's not the case, a discussion about supplementation with your provider is a good idea. But it's important to remember for the service member not to get more than the recommended amount of the upper dose, which is 4,000 international units or 100 micrograms per day.
Thanks, Dave. So now we're going to kind of transition to what you might think about minerals, and in particular, zinc. Zinc, an essential mineral, just like that which is like vitamin D, it helps support immune function. It's found in foods such as shellfish, meat, legumes like chickpeas, lentils, and beans, and even some grains like quinoa. Many breakfast cereals are fortified with zinc. The recommended daily amount for adults is 11 milligrams for males and 8 milligrams for females. And this is equivalent to about one fillet or piece of steak. Zinc can also be obtained in dietary supplements through various forms, such as elemental zinc, zinc picolinate, zinc citrate, zinc acetate, zinc glycerate, and zinc monomethionine. You might even see it as a lozenge, nasal spray, or listed on some over-the-counter cold remedies. However, many of these would be classified as homeopathic products or drugs and not dietary supplements. So, Dave, what do you think about zinc?
Yes, Patty. So zinc is primarily found in meats. And as we move more towards plant-based diets, this is something that we need to keep an eye on. So some studies have shown the duration of acute respiratory illnesses, such as cold or influenza, can be reduced by taking zinc if taken during the winter season or when there's extreme physical or mental stressors. However, the amount taken should be below the tolerable limit of 40 milligrams per day for adults. And the most common adverse events that we see typically are GI in nature. So stomach ache, diarrhea, vomiting, and sometimes individuals complain of a metallic taste in their mouth or throat. I expect service members and soldiers do use zinc in the deployed environment. Some think that it's especially helpful to stay healthy when they're in a malaria endemic area, although our review of the research didn't really address this. But zinc is probably not harmful, and it may be helpful unless it's taken above the upper tolerable limit of 40 milligrams per day.
Dave, this has really been a great discussion. Thank you so much. So how might you advise someone interested in immune supplements to support or boost their immune health?
Sure. So, well, for starters, I would address that dietary supplements should never be a substitute for a healthy, nutritious diet. No dietary supplement can fully boost your immunity. If you're deficient in some vitamins or minerals and can't seem to obtain them through food sources, my advice would be to talk to your healthcare professional or dietitian about whether or not dietary supplements might provide the nutrients needed to stay healthy and what serving sizes would be appropriate. I would also encourage them to revisit their behaviors, like sleep, exercise, alcohol intake, smoking, and the like, all of which affect immune health. In the end, it seems like a dietary supplement might be the right way to go, OPS or OPSS.org should be used as a resource, and utilize the OPS scorecard and check the prohibited list against supplemental fact labels. Also, service members should check out the website hprc-online.org for information about nutrition, sleep, and exercise.
Thank you, Dave, and great points. Remember, the information provided on the OPSS website, that's ops.org, is based on the best and most current scientific information available on dietary supplement topics. Other resources include the NIH's Office of Dietary Supplements and the National Center for Complementary and Integrative Health websites, and also the FDA. If you did not hear our first podcast, then also remember that no dietary supplement can be legally marketed to diagnose, treat, cure, or prevent any disease or health condition, including flus, colds, and COVID-19. Thank you for joining us, and we hope you enjoyed our Under the Magnifying Glass immune supplement session. In the meantime, please visit the fact sheets on the Office of Dietary Supplements website, as well as ops.org, for evidence-based information about specific dietary supplement ingredients for immune health. You can also look up our research articles in the journal Nutrients and JAMA Network Open. And of course, please feel free to send any comments or questions through our Ask the Expert portal on ops.org or opss.org. Thank you for tuning in to Under the Magnifying Glass. Until next time, have a great week.